The National Institute for Communicable Diseases has urged parents to check their children's vaccination status. It's after a rise in diphtheria cases in South Africa. Now, between June last year and March last year, March this year, 40 cases were reported. Of these, 19 were symptomatic and 21 were asymptomatic carriers identified through contact tracing. Let's discuss this a little bit more then. Professor Cheryl Cohen, the head of the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases. Thank you so much for the time. Really appreciate it then as well then, Professor Cohen. Let's just talk about why we're seeing an increase in these cases, if you will.
So good afternoon, and thanks for having me. I think the main reason for the increase in diphtheria cases that we're seeing is a reduction in the vaccine coverage of this vaccine for diphtheria amongst children in South Africa. And this vaccine is really given in the routine immunization program, and the disease was very rare historically. But really, since the SARS-CoV-2 pandemic, and particularly last year and this year, we've seen an increase in cases. And it's really driven by the fact that not all children in South Africa are getting their vaccine doses. Many children do get the first 3 doses at 6, 10, and 14 weeks of age, which are really, really important to protect the children. But for this disease, diphtheria, you really need to have extra doses to give you that long-lasting protection into adulthood. So for diphtheria, in particular, you need to bring your child back again at 18 months for a booster dose, and then again at 6 years, and again at 12 years to get extra booster doses. These are not only for diphtheria. There's some other boosters that you need at that time, but it's really these extra doses that give the long-lasting protection. And what we know is that these extra doses, many parents don't bring their children for. And so what happened is there's this gap in immunity, and this bacteria is really rising up and causing an outbreak.
Professor Cohen, but are people actually willing to go in for all of these additional doses? Especially after COVID-19, it feels as though we, of course, had a time when there was people who were anti-vaxxers, so to speak, and those who were for vaccines. And so even at this point in time, you could get the contentious issue of wanting or not wanting vaccines to be in place.
So absolutely. I think one of the main reasons why the coverage has gone down and why we're seeing this outbreak now is the COVID epidemic. And part of that is hesitancy. What you describe, people are perhaps not as eager to get their vaccines. But I think another part of it is also that the COVID pandemic had a big negative impact on all kinds of health services. When people were locked down, they couldn't take their children for vaccination. And not everyone, then brought their children back to get those vaccines that they missed. I think also one of the drivers of hesitancy or resistance to vaccines is that people think that the diseases we give vaccines for are not common, and that's because our vaccine programs have worked. But what we're seeing with this outbreak is that when we stop vaccinating, these diseases that we had under control for years do come back. And diphtheria is really a very, very severe respiratory disease. 1 in 4 people who get this infection in this outbreak actually die of the disease. And it affects healthy children and healthy adults under 40. So it's really affecting that age group, which shouldn't be getting severe illnesses and dying of them. So I think this is really a wake-up call that we can't forget about vaccine-preventable diseases. And it's so easy to protect your children, right? You just have to take them in. The vaccines are free of charge in the clinic.
And I think that's the important part, to let them know of costings, because that will be important for them. Won't you just help us get a reminder again, Professor Cohen, with regards to the symptoms that come through with regards to diphtheria? Because I think it's very important for people to know that, because testing, yes, but once they see symptoms, perhaps they will then know best.
Yeah, absolutely. So diphtheria is an infection of the throat, and what it really causes is a very, very severe throat infection. So patients will get a sore throat, but this is a much more severe throat than your normal infection. And what's actually happening is the bacteria is living in your throat and producing a toxin that kills the tissue that's protecting the back of your throat. And this can cause what's called a membrane, which can actually lead to blockage of the airway, so you can't breathe. So it's really a very sore throat and often a very swollen neck. We call it a bull neck, where the patient's neck is really swollen with these big glands. And the doctor who sees this, particularly the membrane inside the throat or the swollen glands, should know, and these days think of diphtheria and send a sample to the laboratory to test, but also manage the patient urgently. So it's really a sore throat, but of course not every sore throat is diphtheria. So if you do have a sore throat and you're worried, you should see a healthcare provider, and they can really look to see if you do have those characteristic symptoms of the membrane in the throat and the very swollen neck, to know whether they should be concerned about this disease.
How easily spreadable is it? I mean, is this something now we need to continue to wear masks for example, if you do have it or have symptoms of it?
So it is very infectious. It's a respiratory disease like flu, like COVID. It is spread through respiratory droplets. But importantly, many people who are infected with it won't actually have any symptoms. So they can still spread it to other people. So the best way is not really masks. The best thing to prevent it is vaccination. It's really taking your kids to be vaccinated, because the vaccines are very, very effective, and they really do work. So we're not at this stage recommending masks and those kinds of measures. We're really recommending take your kids to get their vaccines and make sure you check that they're up to date with all those doses, even the later doses that often we forget.
Yeah, let's talk about the latter part with regards to later years. You spoke about how it's in the younger years in which it seems to happen a little bit more then. In the latter years, the impact and the effect, is that as palpable? Are you able to see that effect? And does it lead to the same consequences, which unfortunately have shown to be death?
So I think those later vaccine doses, the 6 years and the 12 years vaccine doses, those are the ones that give you the long-lasting protection into adulthood. In fact, many of the cases we're seeing now are in young adults and older children. So I think those later doses are particularly important to prevent that disease in later life, but also to prevent the spread, because it's children that are spreading the disease, and it's not only the youngest children, it's also the older children.
Yeah, very important one to actually put on as well. One of the things that people had questioned, particularly during COVID-19, was what would happen once you take some of these vaccines as well. Do we have, repercussions thereof, and what would come about once you have them?
So this vaccine, which is the DTP, diphtheria, tetanus, pertussis, is one of the oldest vaccines that we know of, and it's really very safe. Obviously, all vaccines do have some side effects. You can have pain at the injection site. You can sometimes have a fever or a bit of a flu-like illness immediately afterwards. But this is a very, very safe vaccine. It's been given for decades, and it's used all around the world in almost every country throughout the world. So I think that you certainly can have some local reactions and some pain, etc., as we expect with any vaccine. But this is a very, very safe vaccine, and a very old vaccine that you and I and I'm sure most of us as adults had when we were children. So I think it's not a big concern, the safety, and it's not a new vaccine at all. In fact, it's one we've been using for ages, and so we know a lot about the safety.
Professor Cohen, appreciate it. I think there's a lot of learning that comes from this as well, so we certainly appreciate it. Thank you so much for the time. Professor Cheryl Cohen, who is the head for the Center of Respiratory Disease and Meningitis at the NICD, joining us there. As we see just a few more cases then coming through of respiratory diphtheria that's happening across the country. So please, let's just be aware.